Do you want to be less stressed? We all do. Well, what if I told you that I have a quick hack that you can use that's going to make you less stressed, it's going to make you more productive, you're going to get more done, and you're going to be happier. And it's going to cost you nothing. No therapy, no books, nothing. Would you want that technique? If so, stay tuned. In the next 5-6 minutes, I'm going to give you a quick tip that's going to have a powerful impact on your life. Okay, so what I've done here is I've made kind of a little table, and forgive me for just using these sticky notes, but it was the quickest way for me to use a table that would make sense and to get this video done. So I want to talk about coping versus numbing and how we're going to distinguish between the two. So first of all, let's define it. Okay, so coping is active strategies that manage and reduce stress. Let's contrast that with numbing, which is passive strategies that avoid dealing with stress. So one is active and manages and actually reduces stress. The other is passive and it avoids actually coping with stress. Very important for you to understand before we continue. Coping is an active strategy and numbing is completely passive. So let's talk about the purpose and the difference between them and purpose. So the purpose of coping is to actually process the emotions that we're feeling, the anger, the pain, the stress, the hurt. We want to process it. That's why we cope. Numbing, the whole purpose of numbing is distraction and avoidance of dealing with powerful emotions. Keep in mind with purpose here, the whole purpose of numbing is to avoid having to deal with it in any respect or manner. You're feeling so stressed out, you don't want to deal with it? Okay, let's pretend it's not there. That's what numbing does. That's the whole purpose of numbing, right? It's like having somebody yell at you and you plug your ears and say, la, 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 la. You don't want to hear it. Keep that in mind. It's an important distinction. Okay, so let's talk about the mechanism, how they work. With coping, we have active engagement and we actually have something called problem solving, where we define what the problem is and we actually work towards a solution for that problem. With numbing, the mechanism is suppression or numbing, literal numbing against unpleasant emotions that we're feeling. So if we look at coping, the impact is that it improves our mental health and it actually increases feelings of self-confidence and self-efficacy. When you actually deal with something, you feel better and you're actually much more able, I should say, to deal with that problem when it occurs in the future. Contrast that with numbing, where the impact is that it prolongs stress, it decreases our self-confidence because we're not actually coping, right? And it activates our physical stress hormones, cortisol, adrenaline. There is a biological reaction, that fight or flight reaction that we often have. So many of my clients come in and they have these behaviors that they have no idea are numbing behaviors. They think it's a good thing to get on social media and to find some recipes or to get on social media and find some interesting ways to work out. Well, that can turn into an excuse for engaging in mindless scrolling behavior. And that's the whole gotcha part of Instagram, of YouTube even, of social media in general. Is the whole idea behind it is, okay, good, right? You can get access to good information from people that know what they're talking about that can change your life. That's a great idea, but that's not how we use it, and that's not how my clients have been using it, and that's why we have to have this discussion. We cannot understate how important the impact is here. The impact of constantly having numbing behaviors in your life or avoidance behaviors in your life is the problems that you're stressing about never go away. They increase in intensity to the point that you start having more serious problems like panic attacks or cardiovascular problems or muscle tightness, anything. They all have impact. Okay, so how can you distinguish between doing something that's coping and doing something that's numbing? Very important. Let's look at it this way. If you are coping, Some examples of coping would be talking to a friend or going to a therapist. That would be a good idea. Journaling. The act of journaling is a very active strategy because you have to think about what you're going to journal about, and then you have to physically translate that into words on a piece of paper. So you are actually doing work when you are journaling. Mindfulness activities. Yoga would be a good example of a mindfulness activity. Exercising, a proven coping strategy. Or engaging in hobbies that bring you joy. All of those are good examples of coping behaviors. Now let's move to the other side. What are some examples of numbing behaviors? Well, drinking alcohol excessively. We've all been there, we've all done that. Using drugs, using porn, using food as a drug would be an example of numbing ourselves. How often have you been emotional and you come home and you don't want to deal with the problem, so what do? You plunk down on the couch, you watch a TV show, watch your favorite trashy TV show, and you eat at the same time, right? So binge watching TV would be an example of numbing. Excessive social media use. How many times have you got on social media and you find yourself scrolling? 20, 30, 40 minutes later, you're still scrolling. What you're doing there is numbing. You don't want to deal with the emotion you're feeling, and so you're distracting yourself. And then another one, and one that people don't realize, is excessively sleeping. That's a pure avoidance behavior. I don't want to deal with my life, so I'm going to sleep and avoid doing that. Now that we've made it through the list, let's think about ways you can apply this to your life. One thing that I suggest you do is keep a time journal of your life for the next week. Just a week. Just commit to 1 week, 7 days, or even 5 days. I suggest 7 because it includes the weekends, and we act differently on the weekends when we're not working. You'd be surprised. Now, just go through that journal and start tracking what behaviors you engage in. What do you fill your time with? So for instance, you get up at 8 a.m. What do you do at 8 a.m. or 9 a.m. or whenever you get up? What activity are you engaging in? Do you eat immediately? Do you shower? Okay, write that down. What do you do after that? Now, do that for the process of a day, 8 o'clock or whenever you wake up until bedtime. And track that for a week. What you're going to see if you do it accurately is there are huge gaps of time in there, 30 minutes, an hour at a time, that you are engaging in numbing or avoidance behaviors. And we've gone over some examples of those. Once you are much more aware, keep in mind this is the inflection point for all change in your life. Once you are aware, now you can start understanding the impact that it's having on your life. And now you can go out there and start making changes. So this is a quick way to make some really powerful changes in your life. I hope you enjoyed this video. If you did, please like and subscribe and leave a comment. What is your favorite numbing behavior? Or what behavior has gotten you into the most problems and difficulties in your life? I'm Dr. Leif Smith. Thank you for sticking with me in another video, and I will see you in my next video.